So here we are going to talk about some previous year question and answer. The first question here, an adverse reaction to glipizide. So glipizide, it is the anti-diabetic medication. So patient who have type 2 diabetics, we prescribe oral hypoglycemic agents like glipizide. Glipizide is a medication of sulfonylurea class used to treat type 2 diabetes. It is glipizide used together with a diabetic diet and exercise. Basically, it is not indicated for use by itself in type 1 diabetes, right? So now this question, when you give the oral hypoglycemic agent like glipizide, what are the common side effects or adverse effect? Headache, constipation, hypotension, or photosensitivity. The anti-diabetic drugs glipizide can cause photosensitivity. Glipizide may cause adverse skin reaction such as skin rash or itchy, pruritus, or photosensitivity. It is not side effect, it is adverse effect. Side effect is expected, but adverse effect unfortunate. Some patient reaction occur to the medication. So it does not cause headache or constipation or hypotension. Now here's a list of drugs can cause photosensitivity. So your client should avoid the sun with following medication, or if your patient has to take these groups of drugs, you educate them to avoid the sunlight, to avoid the beach, to wear the long sleeve, or wear the sunglasses or sun protective lotion. Let me read one by one. First one is called Thorazine. It is antipsychotic medication, or we call chlorpromazine. Thorazine can cause photosensitivity, hyperreaction to the sunlight. Retinin A or retinoic acid we use for acne. Broad spectrum antibiotics like Bactrim, antifungal like gliocephaloline, antifungal, or if medical condition like exophthalmos, bulging eye, hyperthyroidism, right? If patient have a hypothyroidism, they have a chance to develop exophthalmos, bulging eye. It is good not to go under the sun directly. If your patient take the herbal medication like St. John's wort, tell not to go under the sun. If your patient diagnose lupus nephritis, or lupus erythematosus, it is the autoimmune disease, multi-organ fail, photosensitivity or butterfly rash is most common. If your patient take the fentanyl, it is the medication for pain, or antibiotic ciprofloxacin, or if your patient take the Viagra for erectile dysfunction. Other name is called sildenafil. Good, not to go under the sun. Keep in mind how much dose your patient has to take. If your patient should take Viagra, if they need, maximum dose, 1 tablet. And make sure your patient do not any heart disease or Viagra and nitroglycerin not to take together. So glipizide, the question come about glipizide, anti-diabetics medication, hypoglycemic agent for type 2 diabetes. Also immunoderone, it is antiarrhythmics, or diphenhydramine, antihistamine. Tetracycline do not give to pregnant women or children under 8 as it strains the teeth. Or diuretics, loop diuretics, thiazide diuretics can chance to develop photosensitivity. Here's some more information. So coumadin, it is the anti-clotting factor, prevent the blood clot formation. So coumadin increase the risks of bleeding when take with herbal medication or when take with ginger, ginseng, feverfew, or licorice. St. John's wort decrease the effect of coumadin, right? And coumadin is a blood thinner. Question: a client developed atrial fibrillation and following an acute myocardial infarction. The physician ordered digoxin 0.125 milligram intramuscular daily. The nurse clarified the order with physician because intramuscular administration of digoxin has a chance to lead what? There are 4 options. You have to choose one. Usually, we do not prescribe digoxin intramuscular. But if your patient took it intramuscular, what chance to develop? As we know, digoxin has a low therapeutic index. We need to check the blood level because if it is overdose, chance to develop digoxin toxicity. Whatever it is, in this question said, if you give intramuscular, what can lead to? Increase the serum creatinine level. So digoxin do not cause the nephrotoxicity, and just after use, creatinine level go up, it is very unlikely. If any medication nephrotoxic used for a long time, chance to develop increase the creatinine level. And creatinine is a marker of kidney function. It decreases the serum digoxin level. So if you give the digoxin to the patient, how decrease the digoxin level? The chance to increase. So number 2 is not a answer. Number 3 and 4, increase the serum creatinine kinase or decrease the serum creatinine kinase. So serum creatinine kinase released from the liver. And liver is the organ where the drugs undergo to the metabolism. So if anything is wrong, the chance to increase the enzyme level, not a decrease. So they chose and increase the serum creatinine level. So intramuscular administration of digoxin is not recommended because it causes the severe pain at the injection site and increase the serum creatinine, which complicate interpretation of enzyme level. Regardless of route of administration, the decoction does not increase the serum creatinine level. When decoction is administered, the serum decoction level will raise from 0, not decrease. Next question here. The physician ordered milk of magnesia. Milk of magnesia we give for constipation, and physician ordered 2 teaspoons by mouth as needed. For constipation client, right? How many milliliters should the nurse admit to the client? So if you want to answer this question, you must know what are the content or capability of the teaspoon. Here I said conversion tab. You must know few of them to answer the question. Like here we left the liquid conversion. Okay, liquid. So you see 1 teaspoon equal to 5 ml. But 1 tablespoon equal to 15 ml. So our question said the nurse here 2 teaspoon. So 1 is 5 ml. So 2 must be multiply. So 2 multiply 5, it should be 10. 10 ml. Let me explain a little bit more. When we get any mathematical question in NCLEX board, the conversion is the first steps, if need. You must know 1 liter equal to 1000 ml. 1 milligram equal to 1000 microgram. 1 gram equal to 1000 milligram. 1 kilogram equal to 1000 gram. So big one need to convert to smaller one. It is for anything weight. What else? The length, like 1 inch equal to 2.5 centimeter. Household means you need to know at least 1 kilogram equal to 2.2 pound. Next, for the liquid, 1 ml equal to 1 cc. 1 ml equal to 15 small drops, shortly called GTT. But 1 ml equal to 60 microdrops. And 1 teaspoon equal to 5 ml, but 1 tablespoon equal to 15 ml. 1 ounce equal to 30 ml. So 1 ounce apple juice means 30 ml apple juice. Then 1 cup contain 240 ml. So 1 cup orange juice means 240 ml orange juice. And now another question. A nurse admin vitamin K to a neonate. Medication comes in a concentration to 2 ml, 2 milligram per ml, and ordered dose is 0.5 milligram, is given subcutaneously, right? So now here, how many milliliters should the nurse administer? And record your answer using 2 digital number. So their rationale, they said, the nurse should use the following formula to calculate the doses. What formula? Dose on hand over or divide by quality on hand, dose desired, and X. Then you have to find out X. So let me write something for you. So here we see concentration 2 ml, right? And doctor's order is 0.5 ml. How many? So what are the amount? So amount formula. So amount of the tablet or amount of the medication, right? So how much amount need either tablet or any amount of medication? So equal to the doctor's order. Here doctor ordered 0.5 milligram, and medication given by pharmacist, it is 2 milligram, right? 2 milligram. So 0.5 divided by 2, it should be 0.5 milligram. It is easy way to remember. Let me recap it. The number of the tablet or the amount of the medication equal to the doctor order or prescription medication divided by the medication provided by pharmacist, or what medication in hand. That's it. Next question here. A client must receive a blood transfusion of pegged red blood cell, we called RBC, for anemia. What IV fluid should be nurse used to treat the tubing before handling the blood product? So usually in hospital, we use a stand. It is called T stand. It is looked like T. One side, we hang the blood transfusion bag, what is contained the blood. And another side always accompanied by normal saline solution. Before start the blood transfusion, we give normal saline. As when stop the blood supply, if we need to replace the blood bag, we continue the normal saline. So normal saline always accompany. But if examiner asks this question, let me reiterate it. So for the blood transfusion, we use the normal saline solution. But if examiner asks the question about the PURN, so a patient came to the emergency ward and patient is 40%, 10% burn, what solution we have to give? We always give them lactate ringer solution. So first read the examiner mind. Find out what they want to ask. If blood transfusion, normal saline. If patient is burn, we give them lactate ringer solution. In this question, in the picture, we can see this is the normal healthy person and this is the anemic. We look at the everted part of lower eyelid. So it is, you see, not look like red as normal. It is anemia. If patient has an anemia, we give them blood transfusion. So what is their explanation? Normal saline solution is used for administering blood transfusion. Lactate ringer solution or dextrose solution may cause the blood clotting or RBC hemolysis. So our choice is the lactate ringer. Next question. A physician order codeine is half grain every 4 hours. Half right? For the client experience of pain, how much milligram of codeine should the nurse administer? So codeine is a pain medication. So we give the codeine as an opioid or for the pain management. Right? So when we use codeine is an opioid medication we use to treat mild to moderately severe pain. So if your patient take half every 4 hours, how much milligram codeine should need? So one codeine vial contained basically 60 ml. So half should be 30. So the nurse should admit 30 milligram of codeine. The dose is calculated as here. 1 gram divided by 0.5 equal to 60 and divided by X. So now, next, here, a client who has been treated for diverticulitis is being discharged on oral profenthylline bromide. The nurse should instruct the client to take these drugs. So when diverticula, it is a sac, abnormal sac formation in GI, and inflammation of this sac we call diverticulitis. A patient has a diverticulitis and doctor prescribed the medication called profenthylline bromide. So what we educate our patient? We educate it is good to take 30 minutes before meal or at bedtime. What are the rationale? Profenthylline bromide is used to reduce the secretion and the spasm of gastrointestinal tract in the client with diverticulitis. Diverticulitis is a condition characterized by bowel inflammation and also colonic irritability or causes the septicity. The nurse should instruct the client to take the drug 30 minutes before meals and at the bedtime to reduce the GI motility. Thus relieve the septicity or spasm. Spasm means it causes pain. And taking it with a food, with meal, immediately before a meal or 1 hour after meal would interfere with the drug's action and absorption, and therefore reducing the effectiveness. So it is what we learn from here. We learn the diverticulitis medication called profenthine, good to take 30 minutes before food or at the bedtime for better absorption. Next question. A nurse is administering 2 drugs to a client at the same time. The nurse know the most probable reason for giving the drugs together. Is it for tolerance? Is it for antagonism, hypoactivities, or synergism? So there are 4 options what it would be. So when the healthcare provider administering 2 drugs to a client at the same time, so no health worker want patient develop the tolerance, right? And also when you give the drugs the chance to develop hyperactivity, not hypo. The nurse knows the most probable reason of giving the drugs together. It is not an antagonism, because antagonism means opposite reaction, and synergism means increase the reaction. So synergism, it is a synergistic effect occur when two drugs with the same qualitative effect produce. When given together, a response greater than the either the drug produce when given alone. To tolerant is a person's decreased the response or decreased sensitivity to a drugs. Antagonism occurs when combined response to the two drugs given together is less than the response either the drug produces when given alone. Hypoactivity is a less than usual response to a normal drug dose. Now here, a client with acquired immunodeficiency syndrome, right, ASIP, and receiving the antiviral medication called zidovudine. So which laboratory value indicate an adverse reaction to zidovudine? So red blood cell count, RBC count 1.8 million per cubic milliliter. Fasting blood glucose 104 milligram per dl. Serum calcium level 0.9 milligram per dl, and platelet count 240,000 per cubic milliliter. Imagine I do not know anything about this question and answer. Your patient is a HIV positive, need antiviral zidovudine. Which laboratory values indicate adverse reaction occur, not side effect, adverse reaction. So number 4, platelet count within the normal range, right? Serum calcium, it is normal, 8 to 10. Fasting blood sugar level, it is not hyperglycemia. But red blood cell not within the normal. So it is the only abnormal is here. So we can find it out without knowing everything. So what is their rationale? Because anemia characterized by a decrease the red blood cell below 4 million per cubic milliliter. So anemia is a major adverse effect of zidovudine antiviral medication. The nurse should monitor the client's red blood cell and red blood cell count and assessment for sign and symptom decrease the cellular oxygenation. Zidovudine does not affect the blood glucose level. Zidovudine does not affect the serum calcium level or platelet count, and also the values listed are within the normal range. Fasting blood sugar, calcium, and platelet all within normal range. The client with type 1 diabetes and has been a regime of multiple daily injection therapy, and he being converted to continuous subcutaneous insulin therapy. While teaching the client about the continuous subcutaneous injection therapy, the nurse should tell him that the regime include the use of. So in this question, we have to find out what the examiner asking. Your patient has a type 1 diabetes, and then here has been on a regime of multiple daily injection therapy and is being converted to continuous subcutaneous injection. So the two keyword, one is continuous, right? Other is the multiple drug therapies. While teaching the client about continuous subcutaneous therapy, what nurse should include, right? What need they? Short acting or short and intermediate acting, short and long acting, or intermediate and long acting. Here we go. If patient has a continuous subcutaneous injection regime, used a basal rate and bolus of short-acting insulin. But if patient need multiple daily injection therapy, we use the combination like short-acting and intermediate acting, or short-acting with long-acting insulin. But continuous subcutaneous injection, short-acting insulin only.